Una welcome back This na the part 2 of the tori about cancer. If to say you never watch part 1, make you click the link wey dey top. Oya enjoy this part 2. Bye bye I bin don discuss screening before. Screening dey good to pick up wetin dem dey call precancerous cells. So dat na before dem begin plenty. So wetin be screening? Screening be say dem go do test for you when be say you dey healthy and you no get any symptoms say you get disease. But dem go do this test come see say the cell for your body don dey bad small. And some cancer when dem dey fit do this one include cervical cancer, when be say dem go do wetin dem dey call smear test. Second one be bowel cancer, when dem go do test for your poo. And the third one be breast cancer, when dem go do test when dem dey use wetin dem dey call mammogram. In 2018, people when dem dey call World Health Organization come say for the whole world na these 6 cancer na im dey common. The first one na lung cancer, second na breast, third na colorectal, fourth na prostate, fifth na skin, sixth na stomach. But for people when dey die for cancer, the first one na lung, second na colorectal, 3 na stomach, 4 na liver, 5 na breast. Which treatment dem fit do for cancer if you get am? Hopefully if dem fit get am on time, dem fit comot everything at once. So the first option go be surgery, especially if the thing small, dem fit just comot everything at once. Or sometimes maybe if the thing big well, dem fit comot part of am so that e no go dey cause you too much wahala. The second one na wetin dem dey call radiotherapy, where dem go use high dose radiation. Dem go just put am for the cell so that the cell go die. Sometimes too, if you no comot am completely, dem go put am so that e no go cause problem. The third one na chemotherapy. Here dem go give you chemical when be say e go come go the cancer cell make e die. But the thing with this one be say the side effect for this one plenty well. The fourth one be say dem fit give you hormone when go change the hormone for your body when go fit fight this cancer. And then they use this one in breast and prostate cancer. The last one na wetin dem call immunotherapy, when be say the immune system for your body dem go come make it high, so that if the immune system high, e go fit fight this bad cancer. I hope say you enjoyed this video. Don't forget to subscribe like wetin I tell you before. Share this video, make you dey watch am. And until next time, smile because e dey healthy well. Una bye bye